Hi, my name is Jonathan Gomez, and this is my assignment on psychological disorders. I'm here to talk to you about the disorder that I picked in hands, which is gambling disorder. Mind me reading off my notes on what I studied on. My references will be attached to the links on my YouTube channel that you'll see on here. Sorry, don't mind the bird. It's the only place I have to make this video for now. So about gambling disorder, it tends to be also called a gambling addiction. Compulsive gambling is also a term that is called. Those that deal with a gambling disorder also have similar traits to those that deal with alcoholism, having trouble giving up on drinking alcohol. Seem to have very similar traits on those two, I guess, in terms of them thinking they're relieving stress, doing what they do in terms of gambling and in alcoholism. But I'll stick to the gambling in this particular matter. The disorder can also lead to tons of problems. Financially, they could go in debt, they could lose their homes. It also tends to follow up on having trouble at home with family and friends. Just doesn't tend to end well in most cases in relationships, and it does tend to follow through on work. It may affect work. It may affect how you think at work and what your mind state is on gambling rather than focusing on your situation at work for the time. So I could see that being a big cause. It also this disorder tends to run in the family. Is also environmental factors plays a factor in this, but I believe just seeing it as a child when we're little and we see family members gambling or our friends are gambling and we tend to grow into those habits, we see that we grow into it as well. Gambling disorders, constantly planning ahead, thoughts of making more money by gambling. So they're always thinking ahead of how to make more money. They're thinking ahead of going to the next casino, what they're gonna play, how are they gonna play it. So they're planning ahead onto those, which tends to be the symptoms on it. Um, they also constantly chasing their losses, so they're always going to want to get back what they lost, of course, and they're planning ahead just like what I just stated and wanting to, how do they get back that $100 they lost or even more, $1,000. So they plan the next weekend out and getting to a casino, and getting on that pool, on that blackjack table, Texas Hold'em, and they just want to get that money back, and sometimes I'm sure they just don't. And when they do end up getting their earnings back, the thrill is there already where they just want to go back for more. Like, hey, I won this $1,000. Let me go back. I could win again. Pretty lucky. So I see that. I think that's why Vegas is very addictive to those that tend to want to go on a daily basis. Um, on the percentage of adults, so 1% of adults have a gambling disorder. Some research even shows that 6 to 9% of young adults grow into these gambling disorders as well. So it's common for us to love the thrill of winning, and then we lose, and of course it goes back to us wanting to get back what we lost. So a percentage of us and have that disorder where it just gets us, for young adults, a pretty big number, 6 to 9. Also, other thing I found that other studies show that ethnic and racial minorities have a higher rate of gambling disorders, which is very fascinating. I wouldn't think they would do a study like this, but they did. Again, I would attach my references onto the link so you may go ahead and look them over yourself. Treatments, there's tons of treatments out there in terms of therapy, to help those to really get in the state of mind of maybe letting go of not having to deal their life away with their money, losing family members, losing relationships. Therapy such as psychedelic therapy, behavior therapy, and group and family therapy, where those that love you will take care of you and speak it out in a good manner, where they're looking out for you and not want you to be in trouble with owing money, losing money, losing your house, losing a car, and again, most important part, losing a relationship with family and friends. So they're there for help. Though it does show that 1/3 seem to be able to recover without any of these treatments at hand. They just tend to just, I guess, phase out, tend to, maybe I would assume, tired of losing, just lost the drill. So shows that there is treatment, but some could go without. So that's what I did for psychology disorder. Pay my assignment for gambling disorder. I hope this was good on your end. Thanks. Bye.